And in terms of drug prices, I both have a lot of bruises from battles with various industries and players, but I've also been the huge beneficiary of the generosity of the research-based pharmaceutical industry. And so I think if you look at the history of all donations to good causes, the research-based pharmaceutical industry is way up there in terms of how much they have contributed to these efforts. Now, it didn't start off that easily, but let me just tell you, we would never have been able to scale up our approach to drug-resistant tuberculosis without the help of Lilly and Company. I mean, Lilly and Company invested over $100 million themselves in helping us get these drugs made. And despite the controversies at first, many of the research-based industry that are making antiretrovirals have come around into a partnership that I think has worked. And so these are always difficult discussions. And I think you can expect patent holders to always take a tough line. But what I have witnessed in 20-some years of working on this is that over time, despite difficulties, we've come to a place where we have reached agreement and we've been able to dramatically improve the outcomes of people living with these diseases. And I just have to say, we had a lot of very, what's the right word? There were a lot of hopes that a non-private sector-based approach to developing new drugs for the so-called orphan diseases would work. But I'm an MDR-TB guy, and so far it's been going pretty slowly. And in malaria, again, it's going pretty slowly. And look at the number of antiretrovirals we have. It's related to the fact that there are about 2.5 million people living with HIV in wealthy countries. So market mechanisms are really important in getting new drugs made. The industry is a critically important part of the solutions we want to find. And I think the important thing is just engage intensively, engage early, and try to move as we have in a direction where drugs are available for the poorest.